Used to be able to walk for an hour without thinking about it, to the store, around the block a few times, through the park with your grandchildren. And now, somewhere around the 10-minute mark, it starts a deep ache in your hip, sometimes both hips. And it does not just stay mild, it builds step after step until you find yourself slowing down, looking for somewhere to sit, wondering if you should just turn around and go home. And maybe you have been told that this is just arthritis, that this is just wear and tear, that this is just what happens to hips after 70. And I understand why you might have accepted that. It sounds reasonable. It matches what you have heard from other people your age. But I want to share something with you today that I have seen change the lives of so many of my patients. The pain you feel in your hip after about 10 minutes of walking is very often not actually coming from your hip joint at all. It is coming from a muscle that has quietly weakened over the years without you ever noticing until your hip started speaking up on its behalf. I am Dr. Daniel Chen, and today I want to explain to you exactly why this happens, why it is so common after 70, and the one exercise that when done every single morning has helped so many of my patients walk further with far less pain, sometimes within just a few weeks. So let us begin by understanding the muscle I am talking about. It is called the gluteus medius. Now most people, when they think of their glutes, think of the large muscle that makes up the buttock, the gluteus maximus. But the gluteus medius is different. It is a smaller, deeper muscle located on the side of your hip, just below the bony point you can feel. If you place your hand on the outside of your hip, and its job is one of the most important and most overlooked jobs in the entire body. Every single time you take a step, every single time you lift one foot off the ground, your entire body weight shifts onto the other leg. And in that moment, something needs to stabilize your pelvis to stop it from dropping down on the side of the leg that is lifted. That job belongs to the gluteus medius. On the standing leg, it contracts. It holds your pelvis level. It keeps your hip joint properly aligned, and it absorbs and distributes the forces moving through your hip with every single step. Now here's what happens after 70. The gluteus medius is a muscle that is very easy to lose strength in without ever realizing it, because unlike the muscles in your arms or your legs that you can see getting thinner, the gluteus medius is hidden underneath other muscle layers. You cannot watch it weaken in the mirror. You can only feel the consequences after it already has years of sitting more than walking, years of less varied movement, years of avoiding stairs or hills because of other joint concerns. All of these gradually weaken the gluteus medius, often without any noticeable symptom at all. Until one day, the pelvis is no longer being held level the way it should be, and that is when the trouble begins, when the gluteus medius is too weak to do its job properly. Something called the Trendelenburg pattern develops, named after the surgeon who first described it. With every step, instead of the pelvis staying level, it drops slightly. On the side of the leg that has lifted off the ground, this might only be a few degrees, barely visible to anyone watching you walk, but the consequences inside the hip joint are significant. When the pelvis drops even slightly with each step, the hip joint is placed under abnormal and uneven loading. The forces that should be distributed evenly across the joint surface become concentrated on one part of the joint, specifically the upper outer portion of the hip socket. This concentrated uneven loading, happening with every single step, hundreds of times during even a short walk, creates wear, inflammation, and irritation in the joint structures and in the tendons that attach to the outside of the hip, including a tendon called the gluteus medius tendon itself, and a structure called the trochanteric bursa, a small fluid-filled sac that sits over the bony point of the hip to reduce friction. This is why so much hip pain in older adults, especially the kind that builds gradually during walking and is felt specifically on the outer side of the hip, is not actually arthritis of the hip joint itself. It is a condition called greater trochanteric pain syndrome, or hip bursitis, and it is overwhelmingly driven by weakness in the gluteus medius muscle. Now let me explain why the pain specifically shows up around the 10-minute mark of walking, and not immediately in the first few minutes of walking. Even a weak gluteus medius can compensate reasonably well. The muscle, though weak, has enough initial capacity to do its job adequately for a short period. But muscular endurance is different from muscular strength. A weak muscle fatigues much more quickly than a strong one as you continue walking minute after minute. The gluteus medius, already operating with reduced capacity, begins to fatigue, and as it fatigues, its ability to stabilize the pelvis with each step diminishes further. The Trendelenburg drop becomes more pronounced. The uneven loading on the hip joint increases. The irritation of the bursa and tendon intensifies. And by around the 10-minute mark, for many of my patients, the cumulative effect of this fatiguing, weakening stabilization becomes painful enough to notice and to stop you in your tracks. This is also why the pain often worsens the longer you continue walking. Once it starts, because the muscle is now fatigued and the joint is now irritated, each additional step compounds both problems further. Now I want to address something important, because I know many of my patients have already had imaging done, an X-ray, perhaps an MRI, that showed some degree of arthritis in the hip joint. And I want to be honest with you about this. Having some arthritis visible on an X-ray is extremely common after 70. It is in many ways a normal part of aging, just as we develop wrinkles. Our joints develop changes that are visible on imaging. But here is the critical point that I want every person watching this to understand. The amount of arthritis visible on an X-ray often does not correlate well with the amount of pain a person experiences. Many people with significant arthritis on imaging have very little pain, and many people with minimal arthritis on imaging have significant pain. What this tells us as doctors is that arthritis alone rarely tells the whole story. In many cases, what is actually driving the pain is not the arthritis itself, but the abnormal loading and irritation caused by surrounding muscle weakness, specifically weakness in the gluteus medius. This is enormously good news, because while we cannot reverse existing arthritis, we absolutely can strengthen a weak muscle, and in doing so, we can often significantly reduce the pain, even when the underlying arthritis remains unchanged. This is exactly why the exercise I am about to show you has made such a meaningful difference for so many of my patients, even those who have been told, your hip pain is just arthritis. There is nothing more to do. So let me show you exactly what to do. Every single morning, the exercise is called a side-lying hip abduction, and it directly targets and strengthens the gluteus medius without placing any weight-bearing stress through the hip joint itself, which makes it ideal, even for people with some degree of existing hip arthritis. Here is exactly how to do it. Lie down on your side, on a bed or on a mat on the floor if that is more comfortable for you, with the painful hip facing upward. Stack your hips and shoulders directly on top of each other. You can bend your bottom leg slightly for stability, or keep both legs straight, whichever feels more comfortable. Now, keeping your top leg straight, slowly lift it upward toward the ceiling. Not forward, not backward, straight up. As if you were trying to lift your leg away from your bottom leg, lift it to a comfortable height. You do not need to lift it high. Even a small lift, done correctly, is highly effective. Hold the lifted position for 2 seconds, then slowly lower it back down. With control, do not let it drop. Repeat this 10 to 15 times. Then switch sides and do the same number of repetitions on the other leg, even if only one hip is painful. I want you to do both sides because symmetrical strength supports better overall walking mechanics. Now, I want to give you some important guidance on how to do this correctly, because doing it incorrectly significantly reduces its effectiveness. The single most common mistake is rolling the hip backward as you lift the leg instead of lifting straight up. Many people unconsciously rotate their body slightly backward as they lift the leg. This recruits a different muscle, the hip flexor, rather than the gluteus medius, and significantly reduces the benefit of the exercise to avoid this. Imagine a wall directly behind your back, and try to keep your shoulders, hips, and the back of your pelvis in contact with that imaginary wall throughout the entire movement. If you feel your body rolling backward, slow down and focus on lifting the leg straight up rather than swinging it. The second common mistake is lifting the leg too high. Lifting higher does not mean a better exercise. In fact, lifting too high often causes the pelvis to tilt, which again shifts the work away from the gluteus medius. A moderate, controlled lift to about 30 or 40 degrees is more effective than a large, uncontrolled lift. Quality of movement matters far more than range of movement for this particular exercise. Now, I want to explain why doing this every single morning, specifically in the morning, matters so much. The gluteus medius, like every muscle in the body, responds to consistent stimulation. Performing this exercise first thing in the morning, before you begin your day's walking and activity, pre-activates the muscle. It wakes it up. It primes the neural pathway between your brain and this muscle so that when you do begin walking, the gluteus medius is already firing more effectively rather than starting the day in a dormant, underused state. Many of my patients have described this to me as waking the muscle up before asking it to do its job. Over time, typically within 2 to 4 weeks of consistent daily practice, the gluteus medius genuinely strengthens. Research in physical therapy and orthopedic medicine has consistently shown that targeted strengthening of the gluteus medius significantly reduces pain and improves walking tolerance. In older adults with greater trochanteric pain syndrome and with hip osteoarthritis, I want to share something encouraging with you. A study published in the Journal of Orthopedic and Sports Physical Therapy found that a structured hip abductor strengthening program significantly reduced pain and significantly improved function in patients with chronic lateral hip pain within just 6 weeks. 6 weeks of a simple exercise that takes less than 5 minutes every single morning. Now, I also want to give you 2 additional complementary actions that support this exercise and accelerate your progress. The first is to pay attention to how you stand. Many older adults, particularly those who have been experiencing hip discomfort, develop a habit called hip hanging, where, while standing, they shift their weight predominantly onto one hip, letting that hip jut out to the side. This might feel more comfortable in the moment, but it places that hip's gluteus medius in a lengthened, mechanically disadvantaged position for extended periods throughout the day, further weakening it over time. Try to stand with your weight distributed evenly across both feet as often as you remember to check. The second complementary action is to consider the footwear you walk in. Worn out shoe soles, particularly shoes with uneven wear patterns, can alter the mechanics of every single step you take, placing additional unnecessary demand on an already weakened gluteus medius. If your walking shoes are more than a year old or show visible uneven wear on the soles, it may be worth replacing them. A shoe with good lateral support and an even, stable sole supports proper pelvic stabilization with every step complementing the strengthening work you are doing with the exercise itself. Now, I do want to address one important point of caution. If your hip pain is severe, if it is present even at rest, not just during walking, if you have noticed significant stiffness, particularly first thing in the morning that lasts more than 30 minutes, or if you have any locking, catching, or instability in the joint, please see your doctor for a proper evaluation. Because while gluteus medius weakness is an extremely common contributor to hip pain after 70, it is important to rule out other causes, including more significant hip joint degeneration that may benefit from additional treatment. This exercise is a wonderful evidence-based starting point for the type of hip pain that builds specifically during walking, but it works best as part of a complete picture of your hip health, guided by your doctor when needed. Let me bring everything together for you now. If you are over 70 and your hip begins to hurt, somewhere around the 10-minute mark of walking, here's what is very likely happening. Your gluteus medius, the muscle responsible for stabilizing your pelvis with every single step, has weakened, often silently, over many years. As that muscle fatigues during walking, your pelvis begins to drop slightly with each step you take, creating uneven, concentrated loading on your hip joint and irritation of the surrounding tendons and bursa. This is what so often causes the pain that builds and worsens. The longer you continue walking, the solution is to directly strengthen this muscle with a side-lying hip abduction exercise done every single morning, 10 to 15 repetitions on each side, with careful attention to proper form, keeping your body straight and lifting in a controlled, moderate range. Combine this with even weight distribution while standing and supportive, well-maintained footwear. And for many of my patients, within just a few weeks, the distance they can walk comfortably begins to genuinely increase. This is not a complicated solution. It does not require any equipment. It takes less than 5 minutes every single morning, and it addresses the actual underlying cause of so much hip pain in older adults. Rather than simply managing the symptom, you deserve to walk for as long as you want to without that 10-minute mark dictating how far you can go. I am Dr. Daniel Chen. If this video explains something that has been limiting your walks for longer than it should have, please share it with someone you know who has also had to cut their walk short because of hip pain It might be exactly what helps them. Walk further again. Subscribe to this channel for weekly videos made with genuine care for older adults who deserve real answers. And leave me a comment below. Tell me how far you are currently able to walk comfortably, and I will be genuinely glad to hear how that changes for you over the coming weeks. Take care of yourself, and I will see you in the next video.